Hey everyone, in this video we're going to talk about the spondies, which are orthopedic conditions. So you can see here there's a lot of them, and for the sake of this video I'm going to stick with the endings just to keep it simple. There is losis, lolysis, lolisthesis, and ankylosing spondylitis. So let's get into it. Before I forget, the this is going in, you can kind of end here, but this is going in increasing severity. So lolisthesis is more severe, and then losis is less severe. So just keep that in mind as we talk about these things. So losis, think of degenerative disc disease. I have a memory for this coming up. Mechanism is going to be, it's going to happen over time. It's inflammation of the ligaments, which is going to cause the disc to shrink or the cartilage and bone to fuse. This is going to happen in people over the age of 50. And then in imaging, it's going to show arthritic changes on an X-ray. So this is a picture here. You can see the disc getting smaller, they're shrinking. If you ever see people on like Instagram doing this picture of some like you're crushing someone, this is what I think of when I think of the disc getting smaller. To treat this, it's going to be flexion-based exercises and core stabilization. And then a way I like to remember it is losis is the shortest of the spondies. So you can see here that it's shorter than the rest of these. So it's going to have the disc shrinking. So that's just a way, the disc losing their height. So that's just a way that I like to remember the mechanism. Also to remember, if that doesn't stick, there is triple D, which stands for degenerative disc disease. And you can or drive in or diners, drive-ins, and dives with Guy Fieri. So whatever floats your boat, you can associate him with losis. Going now into low lysis. So think low lysis fracture, mechanism, repetitive stress or overuse, demographic, it'll vary. Imaging in this picture here, the vertebrae all look like a spondy dog, but the collar is what's going to indicate a fracture. So you can see here that line through the edge there. The Scotty dog honestly always confused me, but it is a Scotty dog and it has a collar, so it is a fracture. And a memory trick that I like to remember is a Scotty dog ate a lollipop. So associate lollipop with fracture. Treatment is going to be flexion-based exercises. And then a really important thing to remember is since this is a fracture, you don't want to mobilize it. So more of an exercise-based treatment and no mobilizations. Memory trick. Another memory trick is LOL, I have a fracture. So hopefully that helps with this one. Now for the most severe of the three is going to be thesis. This is going to be a slippage of the vertebrae. You can see in this picture here. Mechanism, it can be degenerative or traumatic, and that goes into the patient population too. So in older adults, it can be some degenerative changes. And then in young athletes, it can also be traumatic. Imaging is going to show a forward slippage, typically at L5 to S1 area. It's also going to have different grades. So this is what a healthy spine looks like. There's grade 1, less than 25%, grade 2, 25 to 50%, grade 3, 50 to 75%, and then grade 4, more than 75%. So how do you treat it? Flexion-based exercises, again, core strengthening and stability exercises. Avoidance of extension. So extension is an aggravating factor. So no prone, because prone that promotes more extension. Also possibility of surgery. Since this is the most severe condition of the three, the patient might have some radicular signs. There might be some more severe things going on. So surgery might be indicated for this patient. A memory trick for this one is think of someone presenting their thesis on a stage and they slip. I don't know if that helps, but that's just how I remembered it. Anything to make it stick, honestly. Now, to compare and contrast the conditions, you're going to see across the board for the three spondies, the evaluation findings and treatment is going to be similar in some degree. Evaluation findings are going to be The flexion is alleviating, and then extension is aggravating. So treat what you see kind of thing, treat with extension and avoid treat with flexion and avoid extension. Also just decrease range of motion, typically from being in pain. So they're going to have decreased motion. Now, differences are going to be what you find on imaging and anatomical findings, mechanism, and also the patient population. So it's not in this picture here, but you can kind of, I'm going to take you to the end here. If you can keep in mind these three conditions, the loci, the three over here, and then spondylitis, that'll be very helpful with as we learn ankylosing spondylitis. So the mechanism for inflammation, the mechanism is inflammation. It's a rheumatic condition. So rheumatic, think systemic, other things going on other than just orthopedic. So systemic being fatigue, weight loss. And then if you Google a picture online of someone with ankylosing spondylitis, they'll be in this kyphotic posture, and that contributes to the restrictive lung condition because the lungs aren't able to expand as much. So they might have some pulmonary dysfunction too. And then for the orthopedic side of it, morning stiffness and pain, and then decreased range of motion. On imaging, it's going to show a fusion of bones. A key indicator they might say is bamboo spine, and that's what we're looking at here. This is what a healthy spine looks like, and then over time, it's going to become fused. So this is inflammation, which is what it starts with, and then this is what it goes to, just that fusion of the bones. So treatment. So this is why I kind of showed those three spondies and then this one. The biggest thing is you're going to treat this with extension-based exercises. Also, aquatic therapy is really good because think like those joints are inflamed, so you want to keep it. Aquatic therapy is good for offloading that. Light aerobic exercise, and then contraindicated is high impact exercise because they have inflammation. They're also having systemic symptoms like fatigue, so you don't want to overwork this population. And then it also goes into energy conservation techniques. So a memory trick is just itis for inflammation. That's the mechanism of this. So now for a recall check. Patient is a 16-year-old gymnast presenting with low back pain. Pain is worse with extension and better with flexion. Range of motion is grossly limited. Imaging reveals slippage of L5 to S1 vertebrae, but is the best intervention for this patient. So I'll give you guys a couple seconds. You can pause this and I'm going to show the answer. So the answer is physio ball rollout. Although it wasn't stated in the question, you had to kind of put the pieces together. This is Spondylolisthesis because it is a younger athlete. So 16-year-old gymnast, pain is worse with extension, better with flexion, and then a key part is slippage of the L5-S1 vertebrae. So those are all things that point to lolisthesis. So going through the answer choices here, prone press-ups would cause pain, so we wouldn't do that. Open books wouldn't address the problem. Physio ball rollouts, that looks good because this condition responds well with flexion-based exercises. And then wall push-ups, that was just a distractor answer. So this chart just kind of puts everything together. You can kind of categorize what's what, comparing and contrasting these three conditions. If you found this video to be helpful, please subscribe, share with a friend so more people can watch these videos. Thank you for watching.